This is Nerissa Bauer. I am a behavioral pediatrician and CEO of Let's Talk Kids Health and creator of Teach Me ADHD. OCD Awareness Week is an international effort that takes place the second week of October each year. I am excited to premiere the interview I just recorded today with not one, but two very special guests, Wray and Baier. Both Brian and Chris share their personal stories about how their families rose to the challenge of coming to understand OCD and how to support their loved one affected by it. Pediatric OCD, or Obsessive Compulsive Disorder, is a type of anxiety disorder that is characterized by intrusive, persistent thoughts and compulsions that interfere with daily living. It can arise at any age and leave one feeling scared, unsettled, or distressed. As we talk in today's episode, it affects the entire family. Now, when I first started Let's Talk Kids Health, my mission has always been to help everyone talk about these issues. And as a behavioral pediatrician, I can tell you that a majority of children don't come to me saying, I'm worried or I'm anxious. No. Their families come with stories about having massive meltdowns, school refusal, trouble falling asleep, being argumentative or oppositional, mood swings, getting upset if things are not done just so, and many more. Pediatric OCD affects 1% to 2% of children and adolescents. Now, it's important to know that there is evidence-based treatment and resources available. During this special episode, you'll hear Chris and Brian talk about resources they used, as well as strategies that help them and their families on their journey. I hope that you'll check out the resources linked to the show notes. Brian's upcoming book, Traveling Rose, is a follow-up to his 2017 award-winning book, Unraveling Rose. The stories feature Rose, a stuffed bunny affected by OCD, giving children the chance to see that they're not alone in their experience. Chris's award-winning film, Unstuck, an OCD kids movie, reveals the complexity of a disorder affecting brain and behavior, while inspiring viewers to believe it's possible to fight your worst fears and defeat OCD. Now, the important thing to remember, if you are listening or watching this and it resonates with you or your family, please talk to your child's pediatrician and seek help. If you're a parent of a child or teen suffering from OCD, know that there are support groups and resources to help you and your other children too. Please share this episode with anyone you think who would benefit. Let's jump right in. Hello, everybody. I am so excited to bring to you this evening this important episode, and I have two very special guests with me, and I'm going to let them both introduce themselves. So, Brian, would you like to go ahead?
Thank you. First of all, thank you for having us. I appreciate it. My name is Brian Wray, and I'm a children's book author. And my books focus on mental and emotional health issues.
I'll just jump right in. My name is Chris Baier. I am a producer of a film about kids with OCD called Unstuck, an OCD kids movie, and I'm also a parent of a teenager with OCD.
Yes, thank you both. And as you know, this week is OCD Awareness Week. And so we thought it was going to be an important conversation to have. And with us, Brian and Chris both will be sharing from their perspectives about how they do what they do and why they do it. And as you know, Brian is a children's book author who has been a repeat guest on my show previously. And Chris, I'm meeting for the first time, but you don't want to miss his input and his perspective. So I would like to just open up the discussion with what is OCD and perhaps, how you both got involved in your respective work in highlighting this fact. Why is it so important?
Well, OCD is obsessive compulsive disorder. And there's a lot of misunderstanding of what OCD is. It's not just about keeping things neat and clean. Breaking it down, obsessive are recurring thoughts that can cause worry, shame, or guilt. And the the compulsion part is when you are compelled to perform compulsions that you believe will neutralize those worry thoughts or obsessions that you're having. And it can be debilitating if it's left unchecked.
Mm-hmm.
And OCD can be almost any issue. It can be, something happening in the world, contamination, or it can be thoughts in your head, intrusive thoughts. It can almost take pretty much any form. So, some people think, well, if it's one thing, it's not OCD, but an obsession that involves a compulsion is going to be OCD. So it's an important thing to get diagnosed.
That's right. And as a behavioral pediatrician, obviously, I see kids with OCD. It is a type of anxiety, right? But it's really important to be able to share a safe place for kids to be able to voice what they're thinking and feeling, because it can be really uncomfortable. They experience that inner turmoil, but it's really important, as Chris said, to help our kids get early diagnosis so that they can get the support and help that they need. And so I guess I'm going to start with Brian. Could you tell us a little bit about, what you're doing in part to help spread awareness about OCD in children?
Sure. The reason I got involved with this sort of to begin with was I was myself a very anxious child. And then our oldest child, around the age of 6 or 7, started to show what I now understand were the early signs of OCD. And so it was a real learning experience. It was certainly a very involved journey for us. And in that process, I started to think, well, there are probably a lot of families out there that might benefit from being able to have this conversation like we needed to have those conversations in our home. And I thought children's books, I was already a writer and starting to focus on storytelling for children. But I really started to narrow that focus down to mental and emotional health issues. Again, because these can be difficult conversations to have with children. But I thought storytelling is a great way to sort of open up those avenues.
Mm-hmm. And I would love to kind of hear from you in terms of how did you start that conversation with your child and, with the professionals?
There was a lot of hit and miss, to be honest, at first, because, again, our oldest was only 6 or 7. So we started by going to therapists. We weren't sure what was happening. Our oldest was asking for a lot of reassurance, which I've since read can be an early sign for children that are dealing. Just a lot of reassurance. Are you okay? Is everything okay? There was a lot of anxiety around separation for fear that something bad would happen to one of us while they were in school. So we really weren't sure what the problem was. We just started by going to a therapist and who thought they were just, they weren't really sure. And it took a couple of years, honestly, to get to the place where we realized what was going on was obsessive compulsive disorder. And then we started seeing a specialist at that time.
Mm-hmm. Yeah, well, I think the important thing to note is, you were feeling that tension in the household. You were seeing your child, just need that constant reassurance and felt that it was, a little bit more than normal, right? Obviously, and it was affecting kind of your daily routine and
affecting their ability to focus in school.
Mm-hmm.
Yes, across the board. Yes.
Yeah. Yeah. And I think in light of mental health, we know that there is not a diagnostic test per se. You can't get an imaging study. You can't swab somebody's throat and sort of diagnose the problem. It really does take persistence, but also the time to understand the context, how the child's doing at home and school, and really getting the facts about, the inner inner thoughts and feelings with kids. I think that's one of the harder things when it comes to diagnosing OCD, especially in pediatric patients, because with adults, right, we are able to communicate effectively our thoughts and feelings, but for kids, especially the younger ones, it can be really hard for them to be able to verbalize, especially that compulsion part. And so again, I'm just glad that, even though it took a while, that you eventually got your answers and the help. Yeah. Chris, may I turn it over to you to share your experience and also some of, what that has led to as well?
Sure. Similar story to Brian's. When my daughter was young, there always seemed to be something that caused a lot of anxiety. Then sought a lot of reassurance, things that like rocks on the street or bees or poison ivy, things that she would fixate on. Other things would not cause her anxiety, but there seemed to be similar, like very specific issues that she would be really concerned about. We didn't think much of it. And then we had some issues around a family member who passed away, and that seemed to cause a lot of anxiety for her. And one day she was watching a show on TV, and she pointed to us and she said, like, I think I need to see a psychologist. So we were very lucky in the fact that our daughter was pretty vocal about how she was feeling. Even though she was 8 years old, that something wasn't right. She didn't like being anxious. And my wife and I took that seriously. We looked into getting a therapist. And similar to Brian, we found somebody who was not necessarily the right person. However, thankfully, a children's book helped us pass along the right way. So I appreciate work that Brian does because I think it helps open up the conversation, especially in kids. So the book that this art therapist read to my daughter identified with the characters, and this led the therapist to say, hey, I'm not the right person for you. You need to seek somebody. I think this may be OCD. You should get a diagnosis. So that very quickly sent us down the road from, we don't know what's going on, our daughter needs help, oh, let's get, maybe she's in a therapist, this will help her, to really going down the road of getting specialized treatment for OCD, finding an OCD therapist who really specialized in the treatment for OCD, and teaching our daughter about exposure therapy. So it was a little quicker road. Thankfully, I feel like our family was lucky that we didn't have to wait years like many people do to get the right diagnosis, and we were able to get my daughter in treatment pretty quickly.
Wow. That story is remarkable for a couple of reasons. One is that, the use of children's books is phenomenal. And Brian and I have talked about this before. I just love using that modality because I think it's such a powerful way to draw kids in. And when they themselves can identify with the character, that storyline, it can open up so much conversation. So, and then secondly, the fact that the therapist acknowledged that this is not my area, and was honest about that, and voiced her concerns to you as a family, so that way you could pivot quickly to get on the right track is really great. And then also for your daughter to be so in tune and able to share that. What do you think contributed to her ability to open up to you and tell you that and share those thoughts with you, Chris?
Just being, comfortable with her parents, and, being open. And we had conversations a lot. We were pretty open with our lives with them, even when they were kids, and always wanted to make sure that they understood in an age appropriate way things that were going on in the news, or things that were happening in our area. And I hope that contributed to an open dialogue between us. And she also, I think, trusted us and looked at us at that age. She's a teenager now, so she has a little different feelings about her parents. But when she was younger, it was like, mom and dad, you can help me. And, we took that seriously and didn't want to be like, oh, you're okay, don't worry about it. We were like, okay, if our kid is pointing us and saying, mom and dad, something's wrong, all right, let's take that seriously.
Mm-hmm. Yeah. Yeah. Well, again, that story is really wonderful. And, like you said, not everybody's family's story is that way, but it's always good to hear when it happens in that way. I'm curious though, Chris, because you are have been doing a lot of work since then to raise awareness about OCD using your expertise, right? Could you tell us more about how you came upon the thought to work on Unstuck? Can you tell us a little bit about that?
Sure. I mean, this kind of piggybacks off what we were just talking about. It's not always easy to kind of talk about what's going on. And we had started a parent group for families in Brooklyn for kids with OCD. So it was like a parent group where parents would meet, we talk and share and laugh and, share